In this video, we are going to discuss the last two categories of the cohort study designs. And we will talk namely about the retrospective cohort study design, and we'll talk also about the retrospective prospective cohort study design, which is also called ambidirectional cohort design. Retrospective cohort study design, to start with, here the information about the exposure is collected sometimes in the past. Mean that we collect the data based on the records or registers, maybe hospital records or any other records which we can get the information which we are interested, and then we contrast the outcome from the date up to the present time. And usually the quality of the retrospective cohort study design is dependent on the quality of the data in the records and the registry, whether the data is complete and accurate, or there are some problems with the data as such data is collected for some other reasons. This is important for the investigator to assess the quality of the data before starting the study, in order to ensure that the data is of good quality, of optimum quality, or is reasonable to be used, and it's not suffering from inaccuracies or incompleteness or any other problems. The advantages of the retrospective cohort study is that can be used to study multiple outcomes due to single exposure, and it's less costly as both the exposure and the outcome have occurred by the time we conduct the study, and it is time saving. We need reasonable time to conduct the study and to submit the final report. The disadvantages are with prospective cohort study, they are not good for very rare diseases, as we need to lengthy time to complete the study. If one uses records that were not designed for the study, the available data may be of poor quality, and this will affect the quality of the study. And there is frequently an absence of data on potential confounding factors. If the data were recorded in the past, we will not be sure of the confounders that will affect the data. And this is a real problem to be considered. And it may be difficult to identify an appropriate exposed cohort and an appropriate comparing group. This is usually difficulty that you have exposed group, and then you need to have a control group or comparison group so that you make comparisons for the exposure and the outcome in both groups. And differential losses to follow up can also bias the retrospective cohort studies, and the investigator is dependent on the records and register that has no control on the exposure and the outcome, as we depend mainly on the records or on the data that we obtained from the records, and then we as investigators do not have any sort of control for the data. The temporality is difficult to identify, as we know that temporality or temporal relationship, we assume that the exposure has occurred and then the outcome or the disease will follow that. But in the retrospective cohort study design, as we start the study, both the exposure and the disease have occurred, so it is difficult to identify or to verify the temporality, as both exposures and outcome, as I have said, have occurred at the time we start the study. Now we'll discuss the second type, which is the ambidirectional cohort study design, and it's also called retrospective prospective cohort study design. As we can see in this slide, which is available from the website of Boston University School of Public Health in the following address, so that you can go back and see it if you are interested. This is the point where we started the study, or the date where we starting the study, and then we look in the past, and this is the retrospective phase, we can subdivide the cohort members into exposed and non-exposed, and then we follow them for prospective phase so that we can find out the incidence of skin cancer among the two groups. For example, we are interested to find if ever there's association between the among the exposed and non-exposed with the incidence of skin rash, and then we'll follow them in the prospective phase to find out if there are incidence of there is incidence of cancer, skin cancer among the two groups. So we have two components: the retrospective phase and the prospective phase, and thus it is called retrospective prospective cohort study design, or it is also called the ambidirectional cohort study. And a cohort study, the direction means that there is both, as I've said, both retrospective and prospective phases of the study. A retrospective component, the researcher looks back at historical data to identify cohort or a cohort of individual based on exposure status and collects baseline data about the previous exposure and the outcome. And also, we have the prospective components. The researcher follow up the cohort members forward in time from the present to collect additional data on outcomes as they occur. Ambidirectional studies are less commonly used as other types of cohort designs, as there are so many problems. They are conceptually consistent with and share elements of advantage of both types of the study. In other words, the investigators are less, they have less tendency towards the use the ambidirectional, and there are so many problems, especially if you go back to retrospective, there are disadvantages, and also for the prospective, there are disadvantages if we collect both disadvantages in such design. So it is less commonly used by the investigators. Often used in epidemiology, in public health, in clinical research, when researchers aim to study the natural history of the disease or long-term effects of exposure. For example, if in one study, you can examine the long term of effects of a specific medication or drug that is used by a group of patients. We start by reviewing the patient records, and this is the retrospective component from the last years, maybe 10 years or 15 years. We have the records, and then we subdivide the individuals into those who are users and non-users. And then from the current point onward, the study would follow these individuals prospectively to monitor new outcomes, such as development of side effects or complications or any other thing. So simply, this is a simple example of the retrospective prospective cohort study design. In the famous example that of the Air Force Health Study, also known as Ranch Hand Study, and this is very famous, initiated by the United States Air Force in 1979 to assess the possible health effects of military personnel's exposure to Agent Orange and to other chemical defoliants sprayed during the Vietnam War in the 60s. And the study was conducted comparing 1,098 pilots exposed to dioxin in Vietnam, Operation Ranch Hand, and also this compared with 1,549 men who flew cargo missions in Southeast Asia during the same time as comparing group as they are not exposed. This is very famous example, and you can refer to it and have further information about this study. Thank you very much.